Hello and welcome. My name is Alana Sutherland. I am a project officer with the Office of Minority Health. I'm pleased to be able to present today an overview of the funding opportunity announcement and competitive application requirements for the Community Level Innovations for Improving Health Outcomes initiative. I'm joined today by Dwayne Barlow, Senior Grants Management Specialist from the HHS Office of the Assistant Secretary for Health, Grants and Acquisitions Management Division, and by Sinceri Cobb Sousa, Director of the OMH Division of Program Operations. For your awareness, this technical assistance webinar is being recorded and will be posted for the duration of the competition on grants.gov following this presentation. Next slide, please. At this time, all participants are muted. We invite you to submit questions at any time during the webinar using the Q&A window. Please ensure that you select the option to send your question to all panelists, and we'll respond during the Q&A session at the end of the presentation. Questions will also be addressed in an FAQs document, which will be posted to grants.gov following this technical assistance webinar. Please note that the information provided during this webinar does not supersede any of the content of the Notice of Funding Opportunity, or what I'll refer to as the NOFO for short. The NOFO is a written document that will govern the competition. We strongly encourage you to subscribe to the NOFO on grants.gov to ensure that you receive notice if there are any revisions made to the NOFO. Next slide, please. The NOFO is available to provide you with essential information and guidance regarding applications. It is highly recommended that you read the entire NOFO document and follow it carefully. Again, the information provided in the NOFO takes precedence over any conflicting details in other documents. Next slide. So I'll begin with an overview of the program. The Community Level Innovations for Improving Health Outcomes initiative aims to demonstrate that community-level innovations that reduce barriers related to social determinants of health, or SDOH, can increase use of preventive health services and make progress toward leading health indicator targets. By developing innovative models, the initiative hopes to reduce health disparities and enhance health outcomes associated with leading health indicators. Next slide. Programmatic goals for the initiative include increasing the use of preventive health services through community-level innovations, improving health outcomes associated with leading health indicators, and reducing health disparities related to social determinants of health. Leading health indicators are a subset of Healthy People 2030 objectives, and they're presented with national baselines and targets, as well as data methodology and measurements, and evidence-based resources. They also include health disparities data, and each leading health indicator focuses on risk factors and behaviors that affect health. Social determinants of health are defined in Healthy People 2030 as conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health functioning and quality of life outcomes and risks. Next slide. There are 23 leading health indicators, and they're organized by life stage, including infants, children and adolescents, adults and older adults, and all ages. There are 5 domains outlined by Healthy People 2030 for the social determinants of health, and those include economic stability, education access and quality, neighborhood and built environment, social and community context, and healthcare access and quality. OMH expects projects to address 2 social determinants of health domains, and at least one, but not more than two, leading health indicators. Next slide. As a whole, project innovations should incorporate collaborative community networks that are prepared to strengthen community support services, provide health resources, and help connect individuals to prevent health services. They should apply community-level public health improvement models, such as the community readiness model or the community organization model. And they should include trained, trusted messengers who work within the community of focus to help bridge gaps to health resources, promote the use of preventive health services, and encourage healthy choices. Trusted messengers might be health professionals like community health workers and healthcare providers. They can also be friends and family members of individuals included in the population of focus, or community and faith-based organizations and leaders. Next slide. Now we will overview expectations for funded projects, beginning with the establishment of a network of organizations engaged through planned and/or existing partnerships that are prepared to begin serving the population of focus within the first 6 months of the project. Organizations included in the collaborative can be community-based organizations that provide social and supportive services that reduce barriers to preventive health services that are related to SDOH. They should also be community-based organizations with experience in health promotion for populations experiencing health disparities, and medical organizations such as safety net providers or other medical providers that have trusted relationships with the population of focus. Network members should participate in project activities, including ongoing strategic planning, implementation, quality improvement, data collection and analysis, and project evaluation. Next slide. Awards under this NOFO will fund innovative approaches to social and supportive services that apply community-level public health improvement models, reflect available national and local data, reduce barriers in 2 social determinants of health domains, and increase use of preventive health services to make progress towards the selected LHI targets. Using the national class standards will help to ensure that project implementation is culturally and linguistically appropriate for the population of focus. And an important note is that medical service expenses are not allowed under this funding opportunity. Next slide. To demonstrate the effectiveness of awarded projects, recipients are expected to implement process and outcomes evaluations. The process evaluation should determine whether the recipient implemented the community-level innovation as planned, and the outcome evaluation should determine whether the innovation reached the population of focus, as well as its impact on health outcomes for that population. Next slide. We also expect recipients to document and share their findings and results with the population being served, the general public, and other interested parties. And this should include best practices, lessons learned, successes, and challenges. Project information should be shared with other OMH recipients through OMH-hosted opportunities such as virtual and in-person meetings. Recipients are also encouraged to involve the partner network and population of focus in the development of publications that describe the community-level innovation and the related impact on health outcomes and health disparities to ensure transparency and credibility of the results. Next slide. Application content is outlined in the following slides. Next slide, please. In full, successful applications will include a project narrative, budget narrative, and appendices. Next slide. The project narrative should include these main sections: the project significance, proposed approach, evaluation description, dissemination plan, and organizational capability. And expectations around each of these sections are detailed in the following slides. Next slide. First, explain your project significance by describing how your project will address health disparities in 2 SDOH domains and 1 or 2 leading health indicators. Focus on underserved populations and how your intervention will incorporate the national standards for culturally and linguistically appropriate services. Next slide. The proposed approach should include a description of the project's goals, objectives, and outcomes. Project goals should reflect the NOFO's goals and align with the selected SDOH domains and leading health indicators. Goals and objectives should be specific, measurable, achievable, realistic, time-bound, inclusive, and equitable, or SMARTY. Measurable outcomes should be identified that demonstrate the impact of your intervention on the population of focus. Envision how your project will benefit the field of health systems analysis, health policy research, health disparities, evidence-based policies, and interventions for underserved populations. Next slide. Your approach should also describe a project plan that details the activities and rationale for the approach. Identify existing partnerships and their contributions, and explain how you plan to address identified and unanticipated barriers and challenges. Next slide. This section should also describe how you will monitor and track progress of the project at the task level, oversight and maintenance of partner engagement, risk management, and the organization's leadership oversight. Next slide. The evaluation section should include in the rationale for the proposed measures or indicators and why they are suitable for assessing your outcomes. Include a logic model, baseline data, measurable targets, and tools for measuring outcomes and lessons learned. Outline methods for measuring change and monitoring project outcomes. Identify the individuals or organizations that will be responsible for project evaluation and describe evaluator independence. Next slide. The dissemination section should describe how you will share your project's results. Consider both innovative and traditional methods. Explain how your findings can inform service delivery and practice, program, and policy development. Next slide. In the organizational capability section, describe your organization and its capability, capacity, and readiness to implement the project and demonstrate its impact. Include an organizational chart. Next slide. Organizational capability also includes the skills and experience available to the organization for forming and managing partnerships, including contractors and consultants. Also, describe the roles and responsibilities of the proposed partners. Next slide. And finally, describe the roles, responsibilities, and competing time commitments of key personnel, including the project director or principal investigator, and those individuals who will oversee the technical, professional, managerial, and support functions. Submit CVs, resumes, or biographical sketches in your appendices that describe key personnel areas of expertise. Next slide. So next is the application review information, summarizing the criteria for the competition that reflect application content expectations. Next slide, please. So we evaluate project significance based on the applicant's ability to demonstrate the need for and potential impact of their project through data about the population of focus. Next slide. We evaluate proposals based on well-defined goals and measurable outcomes, objectives that are specific, measurable, achievable, realistic, time-bound, inclusive, and equitable, and also the anticipated outcomes. Next slide. For the project plan, we evaluate applicants based on the extent to which the rationale for the proposed approach is clear and well supported. The project plan should detail activities, partnerships with public, private, and community organizations, and the use of a community-level public health improvement model to achieve intended outcomes. A reasonable approach to addressing barriers and challenges should also be included. Next slide. For project management, we will assess applications on the adequacy of proposed project management strategies to monitor task completion and control for risks to project progress. Next slide. We assess the proposed evaluation approach based on the description of how project processes and outcomes will be measured and reported using both quantitative and qualitative tools. Individuals and organizations responsible for evaluation activities should be clearly identified. The validity and reliability of proposed measures and indicators will also be considered. Next slide. The description of the proposed dissemination should reflect a feasible and effective approach that is timely and at an appropriate scale based on findings. Next slide. We evaluate the organization description based on the applicant's described capacity, experience, and expertise to complete project activities and achieve project goals within the given time frame. The description of the project's place in relation to the applicant organization should be accurately reflected in the organizational chart appendix. Next slide. We assess the applicant's ability and readiness to leverage a collaborative network, including trusted messengers and others that will contribute to project activities, including ongoing strategic planning, implementation, quality improvement, data collection and analysis, and evaluation. Next slide. We also examine the experience and expertise of key personnel, including evidence of their work and innovative models and their capacity to be engaged in and have substantial knowledge about the project. Next slide. And lastly, the extent to which the proposed budget adequately supports proposed activities and the degree to which the budget and budget narrative show how the total amount requested was determined. The budget narrative should be detailed, reasonable, adequate, cost efficient, and aligned with the proposed technical approach. That concludes my part of the presentation. Thank you for the time to describe the program elements, and I will hand it now to Dwayne Barlow, Senior Grants Management Specialist from the OASH Grants and Acquisitions Management Division. Dwayne.
Thank you very much. Good afternoon, everyone. This is Dwayne, and at this point, we want to discuss the application process. Next slide, please. So, submission dates and times. Your application is due by 6 p.m. Eastern Time on Wednesday, May 15th, 2024. Your submission time will be determined by the date and timestamp provided by grants.gov when you complete your submission. You're strongly encouraged to submit your application a minimum of 3 to 5 days prior to the application closing date. Keep in mind that grants.gov may take up to 48 hours to notify you of a successful submission. If you fail to submit your application by the due date and time, we will not review it and it will receive no further consideration. Next slide, please. Okay, with regard to eligible applicants and applicant eligibility for this NOFO is as follows. So any private, nonprofit, or public entity located in a state is eligible to apply for an award under this NOFO. State includes, in addition to the several states, only the District of Columbia, Guam, the Commonwealth of Puerto Rico, the Northern Mariana Islands, the Virgin Islands, American Samoa, the Trust Territory of the Pacific Islands, and any agency, or instrumentality thereof exclusive of local governments. Eligible entities also include private, not-for-profit, or public faith-based organizations, community-based organizations, and American Indian, Alaska Native, Native American organizations. Next slide, please. Cost sharing or matching. Keep in mind that you're not required to provide cost sharing or matching in your proposed budget. If you voluntarily include cost sharing in your application, you must include in your budget narrative a non-federal sources justification as described in Section H, or your application will be disqualified. Voluntary cost sharing is not expected for research applications. During the merit review of an application, cost sharing will only be considered in the overall review of the adequacy of the total proposed budget, that's the federal share, non-federal share, to support the project proposed. Awarded applications, including cost sharing or matching commitment, whether required or voluntary, will include the commitment on the notice of award at the level proposed in the application. Any change in the cost sharing or matching commitment will require prior approval of the grants management officer. Next slide, please. Application responsiveness criteria. So we will review your application and determine whether it meets the responsiveness criteria below. If your application does not meet the responsiveness criteria, we will disqualify it from competition. We will not review it beyond the initial screening. So the responsiveness criteria for this project is the project abstract summary must state clearly 2 SDOH domains and at least 1, but no more than 2 LHIs that will be the focus of the innovation. Next slide, please. The notice of funding opportunity announcement. So as you was explained, as you heard, or what was explained to you before, the notice of funding opportunity provides information and guidance related to the application. So we ask that you read the entire funding announcement, follow the NOFO carefully, keeping in mind that the information provided in the NOFO takes precedence over any conflicting information in any other documents, including this presentation. Next slide, please. Address to request application package. So you can obtain an application package electronically by accessing grants.gov at www.grants.gov. You can find it by searching the assistance listing. It used to be at CFDA number found on page 1 of the NOFO. The assistance listing number is 93.137. Please be sure to subscribe to the announcement in grants.gov so you receive notification of any updates to the NOFO or supporting documents. Next slide, please. Application submission. So OASH requires that all applications be submitted electronically via grants.gov unless an exemption has been granted by the grants management officer. If you submit an application via any other electronic communication, it will not be accepted for review. Keep in mind that grants.gov is a website portal and all funding opportunities and grant applications are made available on, again, www.grants.gov. An application will not be considered valid until all application components are entered in grants.gov and received by OASH Grants and Acquisitions Management Division according to the deadline specified in the submission dates and time section of the NOFO. You can contact grants.gov with any questions or concerns regarding the electronic application process, or you can give them a call at 1-800-518-4726. Next slide, please. Okay, so your applications must be submitted as 3 files. File 1 should be the entire project narrative. File 2 should be the entire budget narrative, including supporting documentation described in the budget narrative content section. And file 3 should have all documents in the appendices section. Please note that the required standard forms do not apply towards your page count limitations in the submission requirements as stated in the disqualification criteria. Next slide, please. So any files uploaded or attached to the grants.gov application must be of the following file formats. So you can use Microsoft Word, you can use PowerPoint, Adobe PDF, or any of the following image formats. So you can use JPEG, GIF, TIFF, or BMP only. Microsoft Excel files will not be accepted. HHS grant strongly recommends that electronic applications be uploaded as Adobe PDF. If you convert to PDF prior to submission, you may prevent any unintentional formatting that might occur with the submission of an editable document. Check your page count for your PDF and/or print your file to ensure that the document does not exceed the page limit. Next slide, please. Overall, with regard to application submission, please be complete and do not leave blanks on forms unless the information is clearly not applicable. The individual submitting the application forms must have the legal authority to act on behalf of the organization. Next slide, please. To ensure successful submission of your application, carefully follow the step-by-step instructions provided at the blue URL that you see on the screen. These instructions are kept up to date and also provide links to frequently asked questions and other troubleshooting information. Next slide, please. Okay, so with regard to your application elements, the forms you need, application for federal assistance, which is the SF-424, the budget information for non-construction programs, or the SF-424A, the disclosure of lobbying activities, or the SFLLL, the project abstract summary. With regard to files, project narrative, make sure that you submit all project narrative content as a single acceptable file. For the budget narrative, do the same, submit all budget narrative content as a single acceptable file. Now, with regard to appendices, submit all appendix content as a single acceptable file in the attachment section of your grants.gov application. Next slide, please. Please be sure to follow the project narrative format instructions in the NOFO. Your application will be disqualified if it does not conform to the format requirements. You must double space the project narrative pages. You must use 12-point font. You should use an easily readable typeface such as Times New Roman or Arial. You may single space tables or use alternate fonts, but you must ensure that the tables are easy to read. For the appendices and budget narrative, you should use the same formatting specified for the project narrative. Appendix documents such as resumes may use alternate formats common to such documents. Next slide, please. The System for Award Management, or SAM. So if you're registering a new entity in SAM.gov, you need to create a login.gov account if you don't already have one. If you are renewing your registration, your old SAM.gov username and password will not work anymore. You will need to create a login.gov account if you don't already have one. The minimum time frame to complete an initial SAM registration online is about 30 minutes. The time frame for an applicant's registration to become active is up to 10 days and may take longer depending on volume. Your SAM registration must be renewed each year, and the average time frame for updates in SAM to appear in grants.gov is up to 72 hours. Next slide, please. We strongly recommend that applicants check for an active SAM registration well before the application deadline. If you're successful and you receive an award, you must maintain an active SAM registration with current information at all times during the active award. If you've not complied with the SAM registration requirements, HHS may determine that you're not qualified to receive an award and may use that determination as a basis for making an award to another applicant. Should you successfully compete and receive an award, all first-tier subaward recipients must have a UEI number at the time that you, the recipient, make a subaward to them, award to them, excuse me. Next slide, please. Funding restrictions. So if you're successful and receive an award, by accepting the award, you agree that the award and any activities thereunder are subject to all provisions of 45 CFR Part 75, currently in effect or implemented during the period of award, of the department regulations and policies in effect at the time of the award, and any applicable statutory provisions. Keep in mind that your costs for the project must be allowable, allocable, reasonable, and necessary direct expenses or indirect costs in accordance with regulations and current policies. So indirect costs may be included per 45 CFR 75-414. Applicants should indicate which method or rate is used for this application. Keep in mind that pre-award costs are not allowed, and the current salary limitation is $212,100, and that was made effective January 2023. Next slide, please. So your budget narrative and forms. Keep in mind that they must be consistent with the requirements of the NOFO. Budgeted costs must reflect proposed activities. Budget line item descriptions and justification requirements are explained in the NOFO. Suggested table formats are in the NOFO. And then there's information for the plan for oversight of federal award funds. And keep in mind that forms, narrative, and detailed justifications do not count towards page limit. Next slide, please. Application disqualification. If your application does not meet the following requirements, it will be disqualified and receive no further consideration. So the application must be submitted electronically via grants.gov by the due date and time, unless an exemption was granted 2 business days prior to the deadline. Keep in mind that if you successfully submit multiple applications for the same project, we will only review the last application received by the deadline. HHS-GAM has to deem your application eligible. Project narrative must be double-spaced on the equivalent of 8.5 by 11 page size with 1-inch margins on all sides and font size not less than 12 points. Your project narrative must not exceed 30 pages, and the total application, including project narrative, must not exceed 50 pages. Next slide, please. Keep in mind that your application must be in the English language and must be in terms of US dollars. Your federal funds request, including indirect costs, does not or should not exceed the maximum indicated in the award ceiling. Your federal funds request, including indirect costs, must not be below the minimum indicated in the award floor. If you've included any voluntary cost sharing or matching, you must include in your budget narrative a non-federal sources justification. And be sure that the application meets the application responsiveness criteria. Next slide, please. And again, we state here that the responsiveness criteria are that the project abstract summary must state clearly 2 SDOH domains and at least 1, but no more than 2 LHIs. That will be the focus of the innovation. Next slide, please. Supporting documentation and disqualification. So applications that lack the required supporting documentation or submit additional appendix files will not be disqualified from competitive review. However, this may impact your application's rating under the evaluation criteria. So please be sure to follow the submission instructions carefully. Next slide, please. So here again is a review of the application review criteria. We're looking at project significance, the goals, objectives, and outcomes, your project plan, your project management, project evaluation, dissemination, the applicant organization description, the community level expertise and collaborative partnerships, project staff and key roles, and budget reasonableness. Next slide, please. So with regard to application merit review, Eligible applications will be evaluated, commented on, and rated by a panel of independent reviewers with technical expertise in the applicable fields according to the criteria listed in the NOFO. The merit review panel process is formal and confidential. Now, federal staffs are available for questions and to ensure the process is consistent and fair, but do not participate in discussion and scoring. The application are then also reviewed first by GAM staff for administrative and business compliance, and then by OMH program staff for programmatic compliance. Next slide, please. Funding decisions. So the Deputy Assistant Secretary for Minority Health will provide recommendations for funding to the Grants Management Officer for risk analysis. In providing these recommendations, the Deputy Assistant Secretary for Minority Health will take into consideration the following additional factors: the balance of SDOH domains in chosen LIHs or LHIs, and the geographic distribution of projects. So completion of risk analysis and concurrence of the grants management officers, HHS will then issue notices of award. Keep in mind that no decision is final until a notice of award is issued, and all award decisions, including level of funding, if an award is made, are final and you may not appeal. Next slide, please. We are not obligated to make any federal award as a result of this announcement. Only the grants officer can bind the federal government to the expenditure of funds. Keep in mind that if you receive communications to negotiate award or request additional or clarifying information, this does not mean you will receive an award. It only means that your application is still under consideration. All award decisions, including level of funding, if an award is made, are final and you may not appeal. Next slide, please. Funding process, the review of risks posed by the applicant. So HHS will evaluate each application in the fundable range for risks posed by the applicant before issuing an award in accordance with 45 CFR 75.205. OASH will use a risk-based approach and may consider any items such as the following as stated in the NOFO. So we'll take a look at the applicant's financial stability, the quality of management systems, and availability to meet management standards as prescribed in 45 CFR Part 75. We're going to take a look at the history of performance, the reports and findings from audits performed, and we'll take a look at the applicant's ability to effectively implement statutory, regulatory, or other requirements imposed on non-federal entities. Next slide, please. So your plan for oversight of federal award funds. If your internal controls are available online, you may provide the link as part of your plan in the budget narrative. We've also included supplementary information in Section H5, which contains questions applicants may find useful in considering their recipient plans for oversight of federal funds. Next slide, please. Risk review resulting in non-funding determination. So if we determine that your organization does not meet either or both of the minimum qualification standards as described in 45 CFR 75.205A2, and we do not make an award to you as a result, we must report that determination to FAPIS if certain conditions apply. The information reported in FAPIS is available for other organizations to review when considering you for award. So keep that in mind. Next slide, please. Okay, so the notice of award. The notice of award that you could potentially receive notifies a successful applicant of the selection, award amount, and project and budget periods. It includes any conditions on the award, in other words, requirements that must be met as a condition of receiving the grant funds. And it includes standard terms, reporting requirements, and contact information for OASH-GAM and the program office. Next slide, please. Funding process as it relates to points of contact. So GAM is the official contact for awardees throughout the award lifecycle. All official communication related to the award is between GAM and the successful applicant. Unsuccessful applicants will be notified by the program office via letter. Next slide, please. So here's some summary statements and some tips. So for the project narrative description, please be clear, complete, and concise in the project description. Please follow and address exactly what is requested in the NOFO. Don't make the reviewers search for the required information. Generally speaking, the easier the application is to review, the better the rating. Keep in mind also that reviewers are not allowed to do external research, follow embedded links, things like that. Clearly identify the sections of the application and indicate which component is being addressed. Keep in mind that the project narrative must include all required information within the page limit, so do not use appendices to expand the page limit. Next slide, please. Project narrative description, again, make your goals and objectives smart, specific, measurable, achievable, realistic, time-framed, and equitable. Activities presented in the work plan should relate directly to proposed goals and objectives. The work plan, evaluation plan, and the budget should provide a complete picture of how the applicant will address the needs as well as address the purpose and expectations of the NOFO. Next slide, please. With regard to staffing for the project, the staffing should be appropriate and reasonable for the goals, objectives, and activities of the proposed project. Please be complete in describing what staff will do, the expertise required, and the percent of time they will be assigned to the project. Next slide, please. With regard to your budget, the budget should include adequate funds to carry out the proposed work plan, evaluation plan, and administrative responsibilities of the project. The budget should be reasonable and relate directly to the goals and objectives of the project. Do not request more funds than are available as listed in the NOFO. This amount is inclusive of indirect costs. The operating budget should be complete and include federal and non-federal funds, projected program income from fees and third-party payers, and other contributing funds. Next slide, please. Overall, we encourage you to use individuals' full names, the first, middle, and last, to distinguish them for verification in the SAM exclusion records. Keep in mind the electronic submission is required. Please don't wait until the last minute to begin SAM registration or update your registration. Do not wait until the last minute to begin electronic submission because problems could arise. Next slide, please. If you receive an award, only one project director or principal investigator will be named on the award documents. Clearly identify the individual to be the PDPI in your application. We typically expect this to be the person named on the SF 424 in box 8F. Please do not use a placeholder or honorary PDPI because this does not present an accurate picture about who will be responsible for the day-to-day management of the project. If you have not hired an individual to be the PDPI, you should name an interim PDPI and clearly identify that person as such. If you receive an award, a request for a change in PDPI or key personnel under any circumstance requires prior approval of the grants management officer before becoming effective. Next slide, please. Okay, so if you have questions going forward after listening to our presentation today, if you have specifically program questions, you can reach out to Paul Rodriguez. You see his email on the screen, as well as his telephone number. If you have administrative, or financial questions, you can reach out to me. My email address is there, as well as my telephone number. With regard to electronic submission requirements, and if you need grants.gov applicant support, of course, you can go to www.grants.gov, or you can email them at support@grants.gov. Or if you prefer a conversation, you can reach out to them via telephone. And again, that's 1-800-518-4726. We just want to remind you to please Do not contact OS program and grants office staff for grants.gov issues because we don't manage that particular website. Next slide, please. Thank you very much. And at this time, I'd like to turn it back over to the program team for question and answers.
Great. Thank you so much, Dwayne, and thanks, Alana, for the program overview. I'm Sinceri Cobb-Souza, and we'll open now our FAQ session for today's webinar. Please note to continue uploading or noting your questions in the chat box. If we're unable to answer all of the questions that have been entered today, we will address those questions that will be included in the FAQ document that will be posted to grants.gov next week. So please keep the questions coming. We're going to start first with a question regarding eligibility. And this question is for either Dwayne or Alana. If you would please, if you would just clarify for us what applicants or organizations are eligible to apply for this funding opportunity announcement.
I'll take that question. So again, as we stated before, any private, nonprofit, or public entity located in a state is eligible to apply for an award under this NOFO. Keep in mind again that a state includes, in addition to several states, only the District of Columbia, Guam, the Commonwealth of Puerto Rico, the Northern Mariana Islands, the Virgin Islands, American Samoa, the Trust Territory of the Pacific Islands, and any agency or instrumentality thereof exclusive of local governments. We also want to say that eligible entities include private, nonprofit, or public faith-based organizations, community-based organizations, American Indian, Alaska Native, Native American organizations, and that would cover eligibility.
Okay, and there's a follow-up question to that. Alana, if you would just provide a little more detail in terms of the types of organizations, just kind of based on the questions that are been entered in the chat today, if you could provide some examples of those organizations. Thank you.
Sure, thanks, Sinceri. So eligible organizations, some examples would be state governments, county governments, city or township governments, also special district governments and independent school districts, as well as public and state controlled institutions of higher education. Also looking at Native American tribal governments. And other examples would be public housing authorities and Indian housing authorities, as well as Native American tribal organizations. And then again, as Dwayne mentioned, nonprofits, those having a 501c3 status.
Thanks, Alana. Next question to Dwayne. If you would please, if you would clarify for us the actual fund amounts that would include the ceiling and the floor, as well as if you would inform us what is the budget period for the actual fund amount by year expected?
And Dwayne, if you're talking, we're having some audio difficulty hearing you. All right, since Dwayne may be having some issues with his microphone at the moment, just to reiterate, the funding ceiling is $600,000 per budget period. The funding floor would be $475,000 per budget period. I believe the other part of the question was the period of performance. So that is a 48-month or 4-year period of performance beginning in August of 2024.
Thank you, Alana. And to clarify, that fund amount, whether it is at the floor of $475,000 or the ceiling of $600,000, is that per budget period which is 12 months, or the entire period of the program?
That is per 12-month budget period. Thank you.
Next question, Dwayne, hopefully we have your audio. Are for-profit organizations eligible to participate in this funding opportunity?
I am back. Thank you very much. No, only public or private non-profit entities are eligible.
Okay, and a follow-up, this is regarding the deadline. Please, if you would restate the deadline for submission of a competitive application electronically in the grants.gov system. What is the deadline for submission of the competitive application for this announcement?
Applications are due by May 15, 2024 by 6 p.m. Eastern Time.
Follow-up question regarding preparing to apply. What registrations are needed to apply for this funding opportunity? Dwayne.
Your organization or any organization must register online in the System for Award Management, or SAM. Keep in mind that grants.gov will reject submissions from applications with non-existent or expired SAM registrations. And we also want to remind you that a step-by-step description of the requirements for registering your organization to be able to apply for this and other funding announcements are made available and can be found on www.grants.gov.
Great. Next question is for program. Alana, if you would please, if you would just kind of clarify for us, just summarize, because a lot of information was covered in the beginning. What is the purpose of this initiative, and what are the expectations of OMH?
Thank you, Sincere. So again, the Community Level Innovations for Improving Health Outcomes initiative is intended to demonstrate that community level innovations that reduce barriers related to the social determinants of health can increase use of preventive health services and make progress towards leading health indicator targets. OMH expects innovations, your projects in social and supportive services that address social determinants of health to reduce health disparities for populations of focus. And those innovations should include collaborative community networks that are prepared to strengthen community support services. They should provide health resources and help connect individuals to preventive health services. They should also represent novel approaches, things like including trained trusted messengers who work with the community and promote the use of preventive health services and encourage healthy choices.
Thanks. And the next question and follow-up for program. Can we submit multiple applications?
Yes, just note that if you successfully submit multiple applications from the same organization and for the same project, we will only review the last application received by the deadline.
Follow-up for program. Are we supposed to address each of the expectations from the NOFO in our competitive application?
Yes. And award recipients under this announcement should meet each of the expectations in the execution of their funded projects.
Next question, and that is for program. Are we required to use community level public health improvement models in the development of our innovation?
So community level public health improvement models are strongly encouraged. Those are models such as the community readiness model or the community organization model, for example. These models can be useful in planning activities to improve the health of underserved populations. And they often involve community members and partner organizations in creating supportive networks for health promotion and improvement. They can also facilitate novel approaches for community-level innovations.
Thank you. Next question is for grants. Dwayne, if you would just clarify for us, what are the page limits for the competitive application? And also, if you would answer the follow-up question as to whether or not the standard forms that were noted on your slide, if the standard forms apply towards the maximum page limit.
Okay, so your project narrative or a project narrative is limited to 30 pages and does not include your project abstract summary. Since your project narrative plus appendices cannot exceed 50 pages, that leaves 20 pages for your appendices. The appendices, again, should include the items listed, such as work plan, logic model, the project populations of focus, the memorandums of agreement or letters of commitment, the organizational chart, the curriculum, vitae or resume for key project personnel or references cited. Okay. As for the second part of the question, the SF424, the SF424A, the SF42B, and the SFLL, and application components as such do not count towards your 50-page limit.
Thanks, Dwayne. Next question is for program. Alana, if you would, can you answer whether or not the applicant is expected to demonstrate progress in their competitive application if they're expected to demonstrate progress towards the LHI targets?
Yes, recipients should use data to show reductions in barriers related to 2 selected social determinant of health domains and increase use of preventive health services that result in that progress towards the selected LHI targets among the populations of focus. Also of note is that using the national class standards can help to ensure that the project implementation is culturally and linguistically appropriate for the populations of focus to help achieve those the progress towards those targets.
And the next question is for grants. Dwayne, if you can answer for us, how can we stay up to date on any updates or changes to the notice of funding opportunity or additional resources, information that is posted to the grants.gov page?
Okay, so the best way to stay up to date is to subscribe to this NOFO, the NOFO in question on grants.gov. You can go to www.grants.gov and you can click search grants or the search grant tab in the upper left portion of the screen. On the next screen, you can look for search basic criteria fields under search grants. Under the search grants header in the upper left corner, you enter the opportunity number in the field, and then you click the search button. Click on the link under opportunity number header, and then you'll see a red subscribe icon in the right corner. You will then be prompted to either enter your username or password or establish one, after which you'll be able to subscribe and you'll get alerts.
Great. The next question is also for grants. Can we appeal if we are not selected, that is funded for this opportunity? Dwayne?
No, you cannot appeal.
Next question is for grants. Are budgets scored as part of this review process?
Yes, they are.
Next question is for program. Alana, the question is, do I have to publish or disseminate my findings?
We do expect recipients to document and share project findings and results with the populations of focus, as well as the general public and other interested parties. And recipients should publish findings and results in traditional formats, such as scholarly articles or brief reports. And they are also encouraged to involve partner network and populations of focus in the development of publications to ensure that there is transparency and credibility of the results. Also, any published articles should be freely, immediately, and equitably accessible to the public. We also expect recipients to share project information with other OMH recipients within the period of performance. That would be through OMH-hosted opportunities for sharing findings, typically include opportunities like virtual and in-person meetings, for example.
Great. Next question is for program. Are we required to partner with other agencies and/or organizations?
We do strongly encourage collaborative community networks as part of these innovations. We fund projects that include community networks that are prepared to strengthen community support services, provide health resources, and help connect individuals to preventive health services. And collaborative networks are a key component of project development, implementation, and evaluation under initiatives like this. Network membership should include community-based organizations that provide social and supportive services and those with experience in health promotion for populations experiencing health disparities. They can also include medical organizations. And we also encourage recipients to partner with institutions of higher education that have trusted relationships with the populations of focus to conduct evaluation activities.
And next question for program. If you would please, can you tell us if the slides today will be made available and whether the webinar, if it's recorded, will the recording be available for those who are interested?
Yes, it will. The recording of this technical assistance webinar will be posted along with the slides and an FAQs document to grants.gov.
Thank you. Please note that if you have submitted a question today and your question has not been answered, that question will be included in the FAQ document that will be posted to grants.gov. At this time, I'm going to turn it back over to our host, Alana Sutherland.
Thank you, Sincere. I would like to just thank Dwayne Barlow as well as Sincere Cobb-Sousa for their time and contributions today. As a reminder, I'd just like to state one more time that the NOFO does include all of the essential information and guidance regarding applications. So we strongly encourage you to read the entire NOFO document and follow it carefully. Also that you subscribe to the NOFO on grants.gov to ensure that you receive notice of any updates made to the NOFO. And again, the information provided in the NOFO takes precedence over any conflicting details in other documents. So with that, I would like to say thank you. Thank you for your time and for your interest and participation in this webinar. And also thank you for your interest in the funding opportunity. And I wish you the best of luck in the application process.